Forget liposuction. What if you could just melt away those fat cells? Dr. Sanjay Gupta is back from vacation, joins us from Los Angeles to tell us a little bit about some of the latest cosmetic procedures. Hey, Sanjay, welcome back. Nice to see you. Thanks for joining us.
Good morning. Yeah, so you've heard of Doctors Without Borders? Well, these are surgeons without scalpels. Cellulite and fat is a big business, no pun intended. There's obviously creams, medications, all sorts of different devices to get rid of the fat. And the mainstay for a long time has been something called liposuction. Everybody knows what that is. This is an increasingly popular procedure. It is surgery now. You can see the procedure actually being done there. About 372,000 of these procedures done last year, up over 100% from 5 years ago. Incidentally, about 56,000 of those done in men, so a popular procedure for men as well. Now, the procedure costs about $2,500. Usually takes about 6 weeks to recover from this, so that's a long time. 2 to 3 weeks for just the bruising alone, and oftentimes it's not a permanent solution. So that's got all sorts of people thinking about different possibilities. As you mentioned, Soledad, non-surgical options as well. I want to tell you about a couple of them. First of all, something called mesotherapy. Now, this is something you probably haven't heard of. There's only about 8 to 10 mesotherapists in the United States, but it's been around in France since 1952. First of all, I'll just tell you right away, this costs about $6,000, so a lot more expensive even than liposuction, usually taking about 8 to 10 sessions. What they do, they actually inject a chemical in the skin layer, and this chemical, a chemical of medications, actually over time will actually, supposed to anyways, burn away some of the fat underneath the skin layer, actually dissolve some of that fat. Exactly how well that works, or even if it works at all, is the subject of great controversy. There have been no clinical trials showing that really one way or the other here in the United States. Another procedure I want to talk about really quickly as well, endermology. Endermology is also something that's gaining a little bit of popularity. This device actually looks a little bit like a vacuum cleaner or a handheld sander, and really works sort of the same way. You actually sort of vacuum. It's right on the skin again. There are no needles. There's no invasiveness there. It actually sort of sounds like a vacuum cleaner as well, but what it does basically again is try and burn some of the fat underneath. Neither one of those techniques, Soledad, and I'll tell you this right up front because I know a lot of people are sort of interested in this, none of them have any scientific trials behind them. Another technique known as ultrasound, just the basic ultrasound that everyone, again, has heard of that, is gaining a little bit more popularity. This has been around in Israel now for some time. We talked to a lot of plastic surgeons about actually using ultrasound, which is just high-frequency sound waves, again, just on the abdomen, on the neck, something like that. This was the procedure that most of the plastic surgeons we talked to says has the most promise. No clinical trials in that yet as well, but that's something that may look out for that one, ultrasound, to try and burn away some of